President Trump and his aides are praising Health and Human Services Secretary Robert F. Kennedy Jr. on his combative testimony this week. Republican and Democrats both sparred with Kennedy over ongoing chaos in the department and messaging on vaccines.
Let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial, more back and forth.
Do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
That was a statement.
I did not say that.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Now, that testimony left a lot of health officials stunned, including Dr. Dimitri Daskalakis. He resigned last week from his job as the director of the CDC's National Center for Immunization and Respiratory Diseases. And Dr. Daskalakis joins me now. Thank you for joining me this morning. Let me play for you the reaction and the vote of confidence from President Trump after that testimony.
Well, I didn't get to watch the hearings today, but he's a very good person. And he means very well, and he's got some little different ideas. I guarantee a lot of the people at this table like RFK Jr., and I do. But he's got a different take, and we want to listen to all of those takes. But I heard he did very well today.
So the president says he's got a little different take, but he means well. What would you tell the president about the secretary's leadership?
I think that his record stands for itself, and the road to hell is paved with good intentions. So I think that maybe he has the intent to do something good, but it sure seems as if the strategy that he's using is one that's going to compromise the health of Americans.
Let me ask you also about what the Wall Street Journal reporting is that HHS will soon release this report that connects the use of Tylenol during pregnancy to autism. What's your reaction to that pending report?
First, I'll start as a public health professional. I really wish HHS would stop doing public health via soundbite or through leaks. I think if they have something to share, they should share it. So the very first reaction is, they're going to make an assertion, but what data are they going to show to back it up? The American College of Obstetrics and Gynecology, they've been very clear in a recent statement that Tylenol is safe to take during pregnancy. There's meta-analyses that demonstrate there may be an association, but no causal link. So it's like, I have matches in my pocket and I have lung cancer. The matches caused the cancer? No, it was the smoking that caused the cancer. So I don't know what the report's going to say because everything is being done through leaks and through sound bites. I think once the report comes out, it needs to be reviewed by peers. It needs to be gold standard science. It needs to be something that's reproducible. So he's going to say gold standard, but show me the money. Where's the gold standard science if it's not really backed by good evidence that is transparent and available? So we'll see what happens.
I wonder, what should pregnant women do considering what we've heard from the secretary in the past, these debunked theories about vaccinations causing autism and some of the claims of, diabetes in China that are just aren't credible. How should they accept this report?
Well, so first I want to say that this leak or soundbite public health is designed to distract from the fact that Secretary Kennedy is trying to dismantle vaccines and take them away from people. So I'll start by that. Bottom line is that anyone who's pregnant, they really need to be engaged in prenatal care. Talk to your OBGYN. Like I said, the American College of Obstetrics and Gynecology has already put out a statement saying that Tylenol is something that could be used during pregnancy and that it's safe when it's used in a responsible way. So talk to your doctor. Secretary Kennedy said not to trust him for medical advice. Don't trust him for medical advice. When the data comes out, or when the statement comes out about this, when whatever this report is, the next question is, look at the references, look at the data, talk to your OBGYN. I've seen the things that are coming out of HHS where an assertion is made and then the data is not there, or even better, the data is mischaracterized. So, this is the time for gold standard science. People need to review the data.
On immunizations, Florida, the Surgeon General, I'm sure you know, announced that Florida is going to end its vaccine mandate, including for children who want to attend public schools. The president came out with his strongest endorsement yet of some vaccinations. Let's watch that.
Look, you have vaccines that work. They just pure and simple work. They're not controversial at all. And I think those vaccines should be used. Otherwise, some people are going to catch it and they endanger other people. And when you don't have controversy at all, I think people should take it.
So what do you make of what you heard there? And it's interesting, the president said when you don't have controversy at all, people should take it. The endorsement and the growing skepticism of vaccines among some.
Yeah, I think that that the way to address controversy is to talk to your doctor, right? So that's number one. So, controversy is about this soundbite public health that keeps happening. And so I think, that your doctor, your clinician, your pharmacist, they're going to be able to guide you about which vaccines are right for you and your family. So, I hear that and I'm, really inspired that the president is really protecting his legacy as being a really huge champion for vaccines. Operation Warp Speed was frankly a public health miracle. And so I hear that, and it just doesn't jibe with what his secretary is saying. And so, and really what's happening in Florida. With that said, nothing is happening in Florida. An announcement was made by their Surgeon General. Now, more regulatory and legislative work has to happen before anything occurs. And so, I can't speak to Florida's thought process, but I can speak to the outcome that if less vaccines are available or more children don't get vaccinated, the more likely we're going to have outbreaks of vaccine preventable diseases. States make decisions based on their context. I can't Monday morning quarterback that, but I definitely can tell you the outcome is going to be more disease, death, and disability.
Dr. Daskalakis, let me ask you something, your response to something that Senator Rand Paul said about your fitness
Sure.
for the role from which you resigned. I'm sure you heard it, but I don't know if you've been asked about it. He said, while criticizing your support for vaccinating infants against hepatitis B, one of the guys that is the biggest proponent of doing all this is the guy who describes the risky behavior that he and his lifestyle involve, a guy that is so far out of the mainstream. I think most people in America would discount his opinion because of the things he said in the past. He does not represent the mainstream of anything in America. He should have never had a position in government. He went on, but I'll stop there. What do you say to Senator Paul?
Yeah, I don't care what the senator says about my personal life. My record of public service, ending outbreaks, and protecting the public health stands for itself. He doesn't know me, he doesn't know my husband, and he doesn't know my family, so I'm not sure why he feels willing to comment on my personal life. But what he does know, what he does have adequate evidence to conclude, is that Secretary Kennedy is hazardous to the health of American children and other vulnerable people. So, I think that really he should take that up rather than being a bigoted bully toward me or others. I think he's a doctor, right? Doctors aren't supposed to do that.
Dr. Dimitri Daskalakis, thank you so much.